Hi, I'm Sonia Peterson. I'm a licensed professional clinical counselor in California. I'm also a certified rehabilitation counselor and a disability expert. So today's presentation is on vagus nerve activation to reduce symptoms of anxiety and panic. The following is for educational purposes only. This presentation focuses on possible solutions to anxiety and panic. Please consult with a medical doctor or psychiatrist if you or a client is experiencing medical symptoms, and call 911 for a medical emergency. So I'm going to be talking today about the science and physiology involved with the vagus nerve, breath, and the relaxation response. A lot of this information is from James Nestor's book, Breath, The New Science of a Lost Art. So humans have used purposeful breathing techniques throughout history for health and wellness benefits. We're only recently discovering the science behind these techniques. Information on how purposeful breathing can be used to stimulate our vagus nerve and trigger our own body's own relaxation response is available. The use of benzodiazepines are a powerful way to impact the central nervous system to turn off the symptoms of a panic attack, and is still the traditional medical approach to treatment. However, long-term use of benzodiazepines is problematic because these drugs are addictive. Purposeful breathing can be used to stimulate the parasympathetic nervous system and reduce symptoms of anxiety with no side effects. So let's review our nervous system. Our central nervous system is our brain and spinal cord. Our peripheral nervous system is all the nerves that branch out from the spinal cord. So within the peripheral nervous system is our somatic nervous system that guides our voluntary movements, and the autonomic nervous system that regulates the activities that we do without thinking about them. So within our autonomic nervous system, we have two branches: our sympathetic nervous system that sends stimulating signals to our organs. This involves our fight or flight response. And then our parasympathetic nervous system stimulates relaxation and restoration. Our vagus nerve is the longest cranial nerve, and it's the longest nerve in the whole body. It's a network within the nervous system that connects to all our major internal organs. So when our perceived stress level is high, the vagus nerve slows heart rate, circulation, and organ functions. Artificial vagus nerve stimulation has been found to be highly effective for patients suffering from anxiety, depression, and autoimmune diseases. Willing ourselves to breathe slowly opens up communication along the vagal network and relaxes us into a parasympathetic state. So here's an image of our parasympathetic system, and you can see that vagus nerve extending down from the brainstem. So part of that vagal system are nerves that constrict our pupils, stimulate the flow of saliva, and then nerves that come out of that vagus nerve connect with our lungs, our heart, our digestive system, our kidneys, bladder, and reproductive system. So because the vagus nerve is connected with our digestive system, a lot of the branches of the vagus nerve are in our abdomen. Breathing is a power switch to a vast network called the autonomic nervous system. The parasympathetic nervous system stimulates relaxation and restoration. So as molecules of breath descend deeper into our lungs, they switch on parasympathetic nerves, which send more messages for organs to rest and digest. The sympathetic nervous system has an opposite role and sends stimulating signals to our organs, telling them to get ready for action. A profusion of the nerves to the sympathetic nervous system are spread out at the top of the lungs. And again, a lot of information in this presentation, and there are direct quotes from James Nestor's book, Breath. So this is some information about carbon dioxide and panic attacks. The nagging need to breathe is activated from a cluster of neurons called the central chemoreceptors, which are located at the base of the brainstem. So chemoreceptors are cells that measure chemicals. So our taste buds are another example of chemoreceptors. 18% of Americans suffer from some form of anxiety or panic, with these numbers rising every year. Perhaps the best step in treating them and hundreds of millions of others around the world was by first conditioning the central chemoreceptors and the rest of the brain to become more flexible to carbon dioxide levels, by teaching anxious people the art of holding their breath. So let's practice this breathing technique to activate our vagus nerve and turn on that parasympathetic response. So just start with whatever's comfortable for you. Any of these elements will increase the body's relaxation response. So you can do one, two, or all of them. And don't worry about the inhale. You will naturally inhale after you expel all the air out of your lungs. You'll notice that your inhale becomes more comfortable, natural, and deep as you practice this technique. So let's practice. So step one, just bring your focus to your breath. And if it's comfortable for you, close your mouth and breathe in and out through your nose only. Also, if it's helpful, put one hand on your chest and one hand on your belly. And just notice on the inhale how your chest and your belly expand. And then as you exhale, how your chest and belly contract. Just bringing your attention to your inhale and your exhale, breathing in and out through your nose only, if that's comfortable. Again, just noticing the inhale, noticing the air coming in through your nostrils, filling up your sinus cavity, filling up your lungs, noticing your chest and your belly expanding. And then on the exhale, noticing your chest and belly contracting. Just bringing your focus to your breath. Inhaling, chest and belly expanding. And exhaling, noticing the chest and belly contracting. All your awareness is on your breath, inhaling and exhaling through your nose only, if that's comfortable. And just really sensing that nice, big, full expansion of the chest and belly, activating all those branches of the vagus nerve with the expansion of the chest and belly and the contracting of the chest and belly as you're breathing. So the next step we'll do is slowing and expanding our exhale. So we're going to do this by pulling our belly button towards our spine on the exhale. We're going to extend and exaggerate our exhale by pulling our belly button towards our spine as we exhale. So again, breathing in and out through the nose only if that's comfortable. Nice big inhale, expanding our chest and belly on the inhale, and then extending and exaggerating the exhale by pulling our belly button towards our spine as we exhale. So just pulling that belly button towards the spine, expelling all that stale air from the lungs, pulling the belly button towards the spine. Exhale, exhale, exhale. And then when all that air is out of the lungs, a nice big inhale again through the nose. And again on the exhale, pulling the belly button towards the spine. Expelling all that air from the lungs. Exaggerating and extending the exhale till all that air is out of the lungs. And then again, a nice big inhale. Just breathing at your own pace and extending and exaggerating that exhale by pulling the belly button towards the spine will naturally extend that exhale. And then when you're ready, a nice big inhale. Then again, extending and exaggerating the exhale, pulling that belly button in towards the spine, expelling all the air from the lungs. Yeah, nice big inhale, just a nice natural inhale. So again, don't worry about the inhale, don't worry about your pace, just whatever's comfortable for you. You'll naturally inhale after you expel all the air out of your lungs. And as we're doing this, the expansion and the contraction of the chest and the belly is stimulating all those nerve endings of the vagus nerve. And you can do this at any time, sitting in a car, sitting in a meeting, while you're doing some other kind of guided meditation practice. It's really easy to do this breathing technique at any time. So why does this work? Again, breathing in and out through our nose signals to our brain that we're in a relaxed state. Extending our exhale makes the chemoreceptors that measure our oxygen and carbon dioxide levels more flexible, and that also reduces anxiety and panic. And then third, actively engaging our abdomen when breathing activates the vagus nerve, which further stimulates our relaxation response. So I hope this presentation was helpful to you. You can reach out to me via my website, Sonia Peterson, Ph.D.com. Thank you.